Well, of course, it's Thursday, and we're joined now by our In Focus Health reporter, Lindo Madu. And you have a distinguished guest for us today.
Absolutely, and she's joining us from New York. And the 8th International Conference on Urban Health just concluded in Nairobi, held in Africa for the first time. The conference focuses on the health challenges that occur in growing cities and slums. Joining us is Dr. Jo Ivy Buford. She's president of the New York Academy of Medicine. Dr. Buford, welcome to the program.
Thank you.
And thank you for joining us from our New York studios. First off, let me ask you, what were the key issues discussed at this conference?
I think the big issue when you talk about health in cities is the disparities between the rich and the poor. And people really, if you take national averages, you miss those big differences. And you see them in all cities around the world. The degree of difference between the rich and poor obviously is different from a city like New York and a city like Nairobi, but the differences are the same. And that issue of the plight of the poor is the dominant theme of the conference. And
you think that the disparities is basically the main issue why it's important to isolate urban health conference? Why was it so important to do that?
Well, the big issue in urban health is that as of last year, over half the world's population live in cities. And over the next decade or two, probably 70% of the world's population will live in cities. And the cities in the developing world, especially in sub-Saharan Africa and South Asia, are the ones that are growing the fastest. So it's very clear that we really have to focus on all of the factors that add to or keep people from being healthy. So it's not just access to health care, it's also clean water, sanitation, safe housing, and education are among the factors that really contribute to people being healthy or not being able to be healthy.
And one of the challenges when a city is growing, you know, is the fact that there are more and more slums that are coming up. Tell us about some of the issues that were discussed specifically.
Yeah, the program was very interestingly designed, very interestingly. Our co-partner in the meeting was the African Population Health Research Center in Nairobi, and we arranged a actually 3-month-long process, a series of meetings with community-based organizations and slum dwellers in the 3 major informal settlement slums in Nairobi, including Kibera. They developed an agenda of concerns, and the day the conference began really brought those concerns into a set of forums, displays of the activities of the different community-based organizations, and direct conversations with the policymakers. So their thoughts were very much driving the agenda. The big issue, obviously, is these unsafe sanitation conditions, which lead to infectious disease and also big differences in neonatal mortality and maternal mortality, which really have to be a major priority. But we're seeing in Africa also, with globalization, the increasing incidence of the kinds of chronic disease that we see in the northern countries and the developed countries. So in a sense, there's a double burden, and all of those things have to be taken into consideration when looking at the cities and their infrastructure.
Now, what type of solutions were laid out to help these populations?
Well, I think there were 2 that were very exciting. One of them is that policy leaders and political leaders in cities need to think about a sort of pro-poor strategy in developing things like transportation, housing, and health services. We had a keynote address from Enrique Peñalosa, who was a 2-term mayor of Bogota, Colombia, who really developed the idea of sidewalks and parks and express bus lanes rather than cars. His point is that many cities are designed by the wealthy for the wealthy, which means the car gets the dominant attention, and there needs to be an identity shift so that a healthy city is seen as one that doesn't have a lot of ring roads and highways, but it's one in which a child can get on a bicycle and ride safely to anywhere in the city. So that mind shift, that paradigm shift, was a very important message. And I think the other really important message was the the energy and the problem-solving capability of people living in these informal settlements themselves. In fact, we heard from many of them in the meeting, but we also learned that there are over 15 federations of slum dwellers around the world, which actually develop strategies for their communities, especially for land tenure and improving their housing. And many of them are actually in partnership with municipal governments to improve their conditions.
Dr. Buford, that's all the time we have for today. Thank you so much for joining us.
Thank you very much.
Okay, and that was Dr. Buford. She joined us from New York.
Very interesting. Thank you so much.
Indeed.
That's Lenore Madu, our health correspondent. And please remember to join her every Tuesday and Thursdays right here on In Focus.